are very fortunate to have received an engagement award from the Patient-Centered Outcomes Research Institute. And this work really focuses on building the NEC Society's capacity to advance research that is important to patients and families. So what we've done is we've brought together a team of 11 patient families who've been personally affected by NEC, along with 11 clinician researchers who have dedicated their careers to preventing this disease. And together we're working to identify and then hopefully tackle some of the questions and topics that are most urgent and important to our community. Ravi, anything else you want to do on like the overview of this project before I get to our goals?
No, this is, and we'd love to hear your input, and I think Jen will talk about this later, but this is really to help kind of see the future of where we want to go with NEC research.
For sure. So here are our project goals and vision. We've brought together a multidisciplinary team that has been formally trained and learned and is learning how to effectively collaborate to advance patient-centered NEC research. We are working together to determine and advance the priorities for our community in terms of what's most important and urgent for us to begin looking at. And we're also working to develop a model framework so that other neonatal rare disease communities can learn from our lessons and our experiences. And what we hope is that by the time this project concludes in September of 2022, that our research collaborative is built up to the point that it can begin to address some of these topics and priorities that we've identified through this engagement award. Anything else that we should add, Ravi? All right, so we have our first live poll question. So again, if you go to menti.com, you'll be able to click that link in the chat box and your response. So what do you think of when you hear patient-centered outcomes research? And if you've never heard of patient-centered outcomes research before, that's okay. You can say, I'm not sure, or anything like that, but we would love to hear your response. And I'm going to vote on my phone. It's great to see these popping up. Some people are not sure. Some people feel intimidated, like, what is that? Meaningful outcomes that patients and families matter, PCORI. And if anyone's not familiar with PCORI, I encourage you to check it out. I believe it's PCORI.org is their website, but they've been incredibly supportive of the work we've done here at the NEC Society and really influential. And right, no research about us without us. It's so important. Give this another second. All right, because we have a lot of content to cover, I'm going to advance to the next slide. So here's kind of a brief overview of the process that we've gone through so far. So Ravi led our literature review, and we had a survey that I hope many of you participated in. And then Erin Alberger and Lindsay Green went through hundreds of patient family stories that have been submitted to the NEC Society since 2014. And they pulled out themes, questions, topics that are important to patient families. And from those three sources, we generated a list of about 150 topics, potential research questions. And then from that 150, we narrowed our PCORI project team narrowed it down to about 31 topics. Ravi, anything else we should add about the process, the methods that we've used?
We try to be expansive, and of course we wanted to get a working list, and so many of these topics that you'll see that Jen will present, are combinations of related areas of research.
So we're going to share, as Ravi just mentioned, we're going to share the list of 31 topics with you. I anticipate it might feel a little bit overwhelming to see all these topics presented at once, but we would love you to just stick with us, and we're going to be asking you these live poll questions in a few minutes. So as you're looking at the list of topics, just keep these questions in mind. Do the topics resonate with what's important to you? Are your interests and priorities represented? And do you feel like all crucial topics are included in the working list that our team has generated? So here we go. This is the first 10. This is not presented in any order or categorized in any way. They're just randomly generated. So communication amongst the healthcare team and patient families, educational approaches on NEC for patients and providers, shared decision-making, including ethical issues, patient family engagement, empowerment, and integration into the NICU care team, the impact of the built NICU environment on patient families at risk for or impacted by NEC, approaches to support families with follow-up care and decisions, chronic treatment and recovery of NEC, understanding the biology of why NEC occurs, determining the incidence of NEC in different populations, and approaches to defining NEC. So that's the first 10. We're going to move to the second group of 10. So genetic predisposition to NEC and the role of genetic syndromes, the role of the antenatal environment, exposures, conditions, and experiences, role of comorbidities, including cardiac disease and multiple gestation in NEC, identifying interventions that could potentially increase the risk of NEC and its complications, the development and use of medications or treatments to prevent NEC, biomarkers or clinical prediction tools for the prevention of NEC, impact of nutritional composition and approaches on occurrence of NEC, optimizing the use of human milk and lactation support for prevention of NEC, fortification of human milk, tools such as clinical scoring, biomarkers, or imaging for diagnosis of NEC. We're going to go to the next set. This is our last 11. So the role of parents and partnerships with providers and the timing and the determination of a NEC diagnosis, the acute medical treatment and management of NEC, initial surgical treatment of NEC, quality improvement and variation in care between and within units, disparities in NEC, incidence and outcomes, and inequity in decision-making, survival and other in-hospital outcomes, including sepsis, BPD, and growth, long-term neurodevelopmental outcomes, related quality of life measures, long-term GI outcomes, the acute and long-term mental health of patient families impacted by NEC, financial and social emotional burdens of NEC, and the advocacy for research funding into NEC. So that's a lot. But we're going to ask you to please, again, go to the chat box, click on that Menti link, and answer this question, or these few questions, really. How do you feel about our working list of topics that we've generated? Do the topics resonate with what is important to you? Are your interests and priorities represented? And are all crucial topics included? And in a moment, you will have the opportunity, if you feel like there are topics missing, at our next live poll question. Next, you'll have the chance to submit your response to things that are could also be included. I'm going to give this a second because it looks like we have 116 people on live and only 33 voted right now. So I'm going to encourage you, if you have the ability to vote, to please do. We would really love your feedback. So we'll give this another 20 seconds or so. We really want to be thorough to make sure that we are including the topics that are most important to our community. Hoping we could get to at least 50. Let's see, anybody else? All right, I'm going to advance to the next slide. Thank you for taking the time to provide us with your feedback. This is great. So if you felt like there are topics missing, what else should we be including? What other topics come to mind that we should consider including in this working list moving forward? And I know there's got to be at least some responses here. So give it a few seconds. Nutrition of survivors of NEC. And the microbiome. All right, anything else come to mind, or have we been thorough? There we go. Maternal diet while breastfeeding, maternal antibiotic use, transplant. Perfect, this is really helpful. Thank you, everyone. Fertility for NEC survivors. Global NEC rates. Yeah. post-NICU nutrition.
Oh,
Great. All right. Well, thank you. And if other things come to mind once I advance the slide, feel free to email us. And again, I for sure will be on at 1:30 p.m. Eastern time for anyone who has the opportunity to stay on for our networking hours. I'm going to advance to the next slide. So in the coming weeks and months, you all will have the opportunity to help us continue to refine and prioritize this working list. You will receive an email from us, and we hope that you'll participate. We're really relying on your feedback to help us get there and make sure that this working list is really reflective of the community's priorities and values.